So, diabetes is a condition that needs some special care, and getting checkups is super important to make sure our pets stay healthy. I'm Marques, a veterinarian, and today we're going to chat about the essential tests for managing animals with diabetes. In this video, we'll find out about the key tests, what they are, and why they're important for managing the illness. But first, if you haven't subscribed to our channel yet, hit that subscribe button, turn on notifications, and stay updated with everything we've got going on here. Ready? Let's go. Diabetes is a long-term illness affecting the whole body. That means it involves the entire organism of the animal, and if not controlled, can cause some serious damage. It's caused by a lack or malfunction of insulin, which is the hormone in charge of controlling blood sugar levels, aka glycemia. Diabetes is a disease that can't be cured, but it can be managed. Through regular testing, we can keep it under control, watch out for any complications, and tweak treatments when needed. In this video, we'll learn about the main tests recommended for animals diagnosed with diabetes. Diabetes comes in various forms and presentations. In dogs, the most common type is diabetes mellitus type 1. Diabetes mellitus type 1 happens when the pancreas beta cells are destroyed. The pancreas is the organ responsible for making insulin. So in this case, there's no insulin, and without insulin, the dog can't regulate its blood sugar. That's why insulin injections are needed, making the dog insulin dependent. This type of diabetes usually occurs in dogs aged between 7 and 9 years. In cats, the most common type is diabetes mellitus type 2, which is when insulin is produced, but just doesn't work properly. The issue here is that either the pancreas isn't secreting insulin correctly, or cells can't recognize insulin, leading to insulin resistance. It happens in older cats, usually over 10 years old. Once a proper diagnosis is made and treatment is set, periodic tests are needed to keep the disease in check. And now let's talk about those tests. Checking blood sugar levels is the most crucial test for diabetes. It measures blood sugar levels at various times throughout the day. There are set values for blood sugar levels, and both too low or too high values can harm the animal's health. Blood sugar checks can be done at home by the pet owner. With a sterilized needle, the owner pricks one of the animal's extremities. This produces a drop of blood, which is then put into a device called a glucometer, which measures blood sugar levels, just like in people. It's a pretty simple test, but super important for taking care of diabetic animals. A complete blood count, CBC, is a blood test that evaluates red and white blood cells. Through this test, we get a general idea of the patient's health. We can see if there's any anemia, dehydration, or infection, common issues in diabetic animals. Urinalysis, or a urine test, is a simple and low-cost test. It helps assess kidney health and spot potential urinary tract infections. Too much sugar in the urine can damage the kidneys, resulting in kidney disease. Also, high sugar levels in the urine can make an animal more prone to urinary tract infections, as they encourage bacterial growth. The fructosamine test measures blood sugar levels over a more extended period. It can check glucose levels from 2 to 3 weeks before. How often tests are done can vary based on the animal's health and the stage of diabetes. When a pet is first diagnosed, tests need to be done more frequently to assess how well the treatment is working. It's crucial to follow your vet's advice and do the tests when needed. Taking care of diabetic animals involves a dedicated vet team and a committed pet owner. That's the only way to ensure your pet has a good quality of life. If you liked this video and found it helpful in any way, hit that like button, share with your friends, and subscribe to our channel. That way, you'll stay in the loop with all our updates and help ensure your pet's health.